all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank National Veteran Business Development Council, NVBDC.org. It was established to certify both service-disabled and veteran-owned businesses. You'll find out how they can help your business by going to NVBDC.org. We want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. And finally, PuroClean. PuroClean is the paramedics of property damage. It provides water damage remediation, flood water removal, fire and smoke damage remediation, mold removal, biohazard cleanup. It also has a focus on veteran franchisees. You can learn more about them by going to puroclean.com. We're talking to a Dr. Kevin Boehenke today. He's involved in a significant study about cannabis and CBD use by veterans and its impact and possible, focus as a therapy for chronic pain. I think you're going to find this interesting. And after we got done, he said we were talking about the VA's current position, and he directed me to a new public health announcement that VA put out that I wanted to mention at least part of this to you, some things that veterans should know about marijuana and the VA. It's now their position that veterans will not be denied VA benefits because of marijuana use, and they're encouraged to discuss marijuana use with their VA providers. However, VA clinicians cannot recommend medical marijuana or prescriptions for medical marijuana, and VA pharmacies may not fill such prescriptions or pay for medical marijuana. But there is VA research going down on the marijuana benefits and risks, potential for abuse, and under regulatory approval. And it should also be pointed out that the use or possession of marijuana is prohibited at all VA medical centers, locations, and grounds. So when you're on the VA grounds, it's controlled by federal law, not your state law, and therefore not allowed in any of the states, even though states, over half of them now, authorize medical or recreational marijuana. So kind of with that opening, we're going to hear from Dr. Kevin Boehenke about the interesting research that's being done that maybe will put a little more emphasis on, hey, this ought to be something VA can prescribe and regulate on a going forward basis. We want to welcome to Veterans Radio today Dr. Kevin Boehenke. He is working in an area that's of all interest to veterans. I get this all the time from folks. He's looking into medical cannabis. Kevin, welcome to Veterans Radio.
Thanks so much for having me. I'm delighted to be with y'all today.
Well, you received your PhD from the University of Michigan. You are an assistant professor of anesthesiology at the university, and you are the director of the Michigan, is it the Psychedelic Center?
Associate director of the Psychedelic Center, yeah.
We gave you a promotion. Can't get you the money, but we at least can give you the wrong title. Part of the reason we reached out is because there is a study going on called MIVetsCan study looking into the whole issue of chronic pain for veterans and whether or not cannabis can be part of the tool in the tool belt used by medical providers to help veterans in this area. So talk to us a little bit more about what this project is all about.
Yeah, absolutely. So this project is funded through the state of Michigan. So back in 2018, when the adult use cannabis law passed in the state of Michigan, the law set aside money for institutions to do clinical trials specifically to see if cannabis could be helpful for treating medical symptoms or conditions that affected veterans and that were related to suicidality. And this is because, veterans have many health issues such as pain, post-traumatic stress disorder, many things that relate to that service that they did for our country. So this money was put aside to really see, is cannabis helpful? When is it helpful? And can it be useful in the medical context for veterans specifically? And so what our project is doing is we're focused in on chronic pain because this is so prevalent among veterans. And we are doing two separate clinical trials. One of them is focused on cannabidiol or CBD. And CBD CBD is a compound that there's a lot of excitement about because it doesn't get you high and it has no abuse or addiction potential, and it tends to be very, very safe. So we want to see if this is helpful for pain symptoms. So in this first study, people can receive either CBD or placebo that they can flexibly dose themselves for 4 weeks. And we ship study medication to their homes after they, screen for the study and go through all those things. And then they send it back to us after taking it for 4 weeks. In the second study, which is called Can Coach, short for Cannabis Coaching, participants will meet one-on-one with a trained cannabis coach. So these are people who have their Masters of Social Work degree. They have been trained on the scientific evidence around cannabis and pain, its effects on different pain symptoms, the effects of things like CBD versus THC, the differences between smoking, vaping, eating, all this information. And these coaches work one-on-one with the study participant to help them optimize their use of cannabis for pain symptoms. So the products that people will use in this coaching intervention, they will get themselves from, state licensed dispensaries. But then they work with that coach one-on-one to be like, okay, gosh, like I used an edible one time and I slept really well, but then I woke up feeling foggy and I was affected the next day. So I want that sleep effect because I know that helps my pain, but I really don't want to be impaired the next day. What do I do? And so the coach will work with them, in this sort of one-on-one context over 4 individualized treatment sessions to help them refine that use to maximize benefit and minimize harm associated with cannabis and that cannabis use for chronic pain.
We're going to back up and talk about some things you're talking about, but I kind of want to highlight for folks, and we're talking to Dr. Kevin Boehenke, who is the assistant professor in the Department of Anesthesiology. He's also the associate director of the Michigan Psychedelic Center, and he's involved in this MIVetsCan studies being funded by the state of Michigan, where marijuana is legal both for medical and recreational use. But CBD, tell us how CBD is regulated as compared to marijuana or cannabis.
Yeah, so CBD is treated a little bit differently. So products that have less than 0.3% THC, so THC or delta-9 tetrahydrocannabinol is the main intoxicating component in cannabis. If they have more than 0.3% THC, they're considered marijuana under federal law. They're considered to be illegal and Schedule 1 product. So under the Federal Controlled Substances Act, any substance that is Schedule 1 has no accepted medical purpose and a high potential for abuse or misuse. And so it's not used therapeutically. So those products that are above that 0.3% THC threshold, Schedule 1, illegal, criminalized, technically no therapeutic benefit according to federal law. If they have less than 0.3% THC, then they are descheduled under the Controlled Substances Act. So they're not regulated under it. There's no criminal penalties for use. And so CBD products that have less than 0.3% THC, like the one we're using for this study, are descheduled. And so that's the distinction. So that 0.3% THC is the distinction between a illegal criminalized product and a descheduled legal product.
What you're trying to do with these studies is put some rigor around, some clinical trial work around, hey, does CBD help? Hey, does cannabis help? And put a little bit more of scientific rigor around it rather than just sort of anecdotal, hey, my buddy down at the Post told me he's taken it and it's helping, I'm going to take it. So that's what you're trying to get to is a more rigorous scientific approach, I assume.
Yep, that is exactly what we're doing. We want to do high quality scientific studies to say, is this something that's helpful? Can we add it to, as you said, to the treatment toolbox as something that might help people with pain?
And in Michigan, when they passed the law about recreational marijuana, they said, hey, we're going to take some of the tax dollars we generate from this and we're going to put it into research. And that's where this study gets funded from. And I point this out because we're at a point in time when there's all this confusion about VA funding and federal funding for research projects. This project and these two studies, both CBD Care and Can Coach, they're not impacted by all that federal chaos that's going on, correct?
That is correct. They're funded by the state, so we have had no issues with these studies.
Tell us a little bit about, your mindset as you went into this and kind of maybe where you're at or thinking today as a research scientist.
Yeah, so going into this project, something that was super important to me and the other folks on the team was, let's make sure that we're doing work that is relevant and meaningful to veterans with pain. So we went about that in a few different ways. One, we obviously looked at the scientific literature to say, what are the types of studies that have been done and what haven't been done? And we noticed that the scientific literature around CBD was extremely lacking. And so that was a really strong place scientifically to look. Then we went and spoke to different veteran organizations, like the Ann Arbor VA has a research engagement council. And so we went and presented our ideas to them and said, what do you think? Is this something that might be helpful? And so many folks who we spoke to said, we want to know about CBD. It doesn't get you high. We don't want to have issues with drug testing from our employers. Like, we want something that helps our pain and allows us to function. So we knew that that was a really strong idea that had support and buy-in from these veterans groups that we talked to. For the coaching intervention, similarly, like, we presented this idea, which as a researcher, I and the folks on my team really liked, because we thought this will allow us to test a couple things. One, can we help people use their cannabis more skillfully? And two, how do we make sure that we allow people to use the vast variety of cannabis products that are available and legal in the Michigan marketplace, and not constrain them to only being able to use a single product, which is what you typically have to do when people are enrolled in a clinical trial for a study medication. They can pretty much only use that study medication. With this coaching approach, people can purchase and use like a topical product, a tincture, and a vaporizer all within their treatment regimen. We work with them no matter where they're at and help them optimize that use. So we like that scientifically because it provides more flexibility. The veterans we talk to really like that because they can then, after the study is done, they have the skills that they need to operate within the legal climate of having these medical and adult use dispensaries where they can go buy these products. And they've gotten the support that they need that oftentimes they can't get from a physician either at the VA or outside of the VA because most doctors don't get any education about cannabis in medical school.
Yeah, well, I'm gonna get to this a little bit more, but I want to pick up on your, the issue about legality, and these numbers change, but it's something like 39 of the 50 states in the country allow it for medical use, and 24 states, so almost half of them, allow it for recreational use.
Yep.
But it's still illegal, it's still a Schedule I drug on the federal registry, although that may change, who knows. But because of that, and because this is sort of a new trend, as you say, this isn't part of medical training for doctors, primary care physicians, if you will, or pain physicians when they go through medical school. And can you talk a little bit about will these studies, and maybe it's about how the coach gets certified, deal with issues like dosage, efficacy, quality, delivery systems? I mean, it's more complicated than going to your local drugstore and just getting, the prescribed pills over the counter. There's a heck of a lot of variety today, and because it isn't so regulated, how do you take that into account in the Can Coach program?
Yeah, so that's all those reasons that you just mentioned are exactly why we developed this, because we know that that's the exact information that people need to use this information skillfully and to use cannabis as a useful medication. So we scoured the scientific literature, and there have been studies looking at what happens if people smoke or they eat or they use a tincture or topical product. How quickly does it take effect? How long does it last? What are the effects of CBD versus THC in like these acute dosing situations? What kind of doses have been used in the scientific literature? We compiled that all together. We digested that all into easily deliverable information, both in terms of the handouts that we give to participants, as well as in this manual that we developed for this intervention. So participants will come into this study, they can ask the questions they need to ask. We also have these really well-crafted materials so they can walk away feeling very comfortable that what they're doing is informed by the best available scientific evidence around the effects of these compounds and how they might be affecting their bodies, as well as how the different delivery systems might affect them and their unique situation.
And when you generally are talking medications, you're also worrying about interactions between, the heart doctor gave me this, and my doctor for my gout gave me that, and my headache doctor gave me that. Sometimes we have I'm not sure what the right medical term is, but I'll call it cross-contamination problems. We have these things working against each other. How is that taken into account to make sure that when you're doing your rigorous study here, you're not really seeing the impact of, it's not the CBD or the cannabis, it's that plus something else?
Yeah, this is a great question. So safety is our top priority in these studies. So for the CBD study, we're using a product that has been approved by the FDA for other medical indications. That's called Epidiolex. It contains plant-derived CBD. And so that has been tested and is actually available commercially for medical conditions other than pain. So like, for example, you could go to your physician and say, hey, I want this off-label prescription for Epidiolex. And if they think that it would be helpful for you, you could actually get it. So there's that side of things on the purity of the product that we're using for the CBD study. And because it's been tested, it's gone through the whole FDA approval process, we know a good deal about what kind of interactions, this CBD product has. And it's mostly with anticonvulsant medications. There are that's what showed up in those clinical trials. There might be some other interactions that continue to show up. But, the FDA reviewed this. We also have our own institutional review board, or IRB, and they look at studies like this and they say, will this be safe? And if something happens for a study participant where there's a safety issue, how will you protect that person and make sure they get what they need? So, we do phone calls with our study participants. They can enter any side effects that they experience into their study app, and we monitor these very closely as well. So there's these multiple different systems that we use to ensure participant safety. In the coaching intervention, because we're not giving people study medication directly, they're purchasing their own cannabis products from cannabis dispensaries. If they bring up a specific medication to us, we can go and look at it, but we also encourage people to talk to their clinicians to say, is there a potential interaction with some of these medications that you might be taking with cannabis? Oftentimes, what we see in the scientific literature is that there's a lot of theoretical interactions. There's a few known interactions, but a lot of times what happens is when people add cannabis into their treatment regimen, it is you're extremely careful with your dosing. So you do a really like a start low, go slow situation. And if you notice anything that is concerning, then you stop what you're doing, you talk to a clinician, and you make sure that you're keeping yourself safe.
Well, you mentioned something that I want to highlight, which is if you're out there, veterans, using recreational cannabis because you're in one of those 24 states, or in even more if medical cannabis, you should be having a discussion with your primary care physician about it so that they know that you're using that as well. They can look at issues of possible drug interactions. But you can't really have that conversation with the VA because it's not allowed to be prescribed or used in the VA. So make sure you're, as the good doctor says here, start low, go slow, but have that conversation. Don't think you should do it all on your own. And that's why we're doing these clinical trials, is to try to give better information to people. Let me ask about clinical trials, Dr. Boehenke, are all about size, right? So talk to us about the size of the clinical trial for CBD Care and for Can Coach.
Yeah, so these are very large clinical trials. Each one we're recruiting 468 individuals into. So this is the size of study, very similar to some of the large pain drug studies that are done by pharmaceutical companies. So we are extremely lucky and grateful to have this opportunity to do studies like this that, they wouldn't be possible without the advocacy of veterans and other groups to get this money put aside in the law that passed legalizing adult use cannabis. So I'm just really grateful for that forethought to be able to fund these sorts of well-powered studies that frankly have not been possible in a lot of different situations, both because of cannabis legality and because it's the National Institutes of Health and other large funding bodies have historically kind of stayed away from funding this kind of research. That is definitely changing now, I'm glad to say, although with this current situation, there's a lot more uncertainty now with relation to that. But, for example, my colleagues and I are doing a separate study related to CBD that is funded through the National Institutes of Health. Some of these studies happening in a different way now than was even possible like 10 years ago.
So you have a large study group. You're recruiting 468 individuals into each. What's the timing on this? Does this take a year, 5 years? What's the anticipated timing?
Yeah, we anticipate it will take at least a couple more years. So, and both of these studies are available to veterans in any of these states with legal adult use cannabis. And because they're all done via telemedicine, like I said, for people in CBD care, we can ship study medication to California or to Maine. For Can Coach, like those study sessions happen via, a HIPAA compliant video platform. So it's something that, you can meet with the coaches in the comfort of your own home. So, it means that we're hoping to have a wide reach with these studies.
And that's really important. We hear this out of the VA research when we talk to their researchers about, veterans are of all types of races and ethnicities and ages, genders. You have to have a big enough study that you can say, well, this is what the impact is to female veterans as compared to male veterans, and split that maybe into African American veterans versus Hispanic. I mean, you're trying to take all of that demographic stuff and figure it out, right?
Yeah, I mean, we're doing our best to account for all those things. That's why we've had such a strong, engagement component with veteran groups at each stage of the way, and are hoping to continue that throughout this study. And also knowing that, even though these are two large studies, it's important to, have these results looked at by other teams and other investigators, and ideally have large other studies going by other teams and other sites too, to see if these results hold up. Because even though these, again, are large and well-designed studies, one study is never definitive. I
can tell you, and I can tell our audience, what the last paragraph of your report's going to say. It's going to say, further research is still necessary.
You got it.
Hey, I want to let our veteran radio listeners know how they can learn more about this. And if you're a veteran, or if you're friend of a veteran, you say, hey, I think my friend ought to get involved in this. They can, how do I enroll? Go to the website, MIVetsCan.org. MIVETS CAN.org. MIVetsCan.org talks about the study, talks about the overview. There's tutorials and resources. But there's a big green Enroll Now button, and I assume that's how people get themselves involved in these things, Doctor.
Yep, that's exactly right. So if you go to the website, you contact the study team, you go to the Enroll Now place, you'll be able to talk to one of our wonderful study team members who can help walk you through the process of signing up for these studies. I will say also, before joining one of the clinical trials, participants would need to join the registry, which helps them get acclimated to the study procedures and the study app, and just make sure that they're comfortable with the whole situation. Once they're in that, then they can participate in one or both of the clinical trials, assuming that they meet the eligibility criteria. And so it's something we're just really hoping that folks will be interested in and find useful. So thanks so much for sharing out the information about the study.
Well, we certainly appreciate Kevin Boehenke, PhD, principal investigator on these studies, spending some time today with Veterans Radio to talk about these studies, sort of the two different natures of them, CBD Care versus Can Coach. Very interesting Can Coach. So we would hope people all around the country will go to the website and enroll, because your involvement as a veteran will help others, because this is a large study with rigorous detail to it that can ultimately withstand scrutiny and be used by others, and maybe even the federal government and the VA at some time will come around on this issue. But Kevin, thanks for the time that you've devoted to us today, and we'll be back, I guess, in a year or two to find out how the results are going.
Sounds good. Yeah, would be delighted to speak with you anytime. And thanks so much for having me, Jim. Lovely speaking with you today.
That's Dr. Kevin Boehenke with the University of Michigan MIVetsCan study. Very interesting, and we'll keep an eye on that and report back to you in the future. And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by visiting us at veteransradio.org. That's veteransradio.org. We would again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. And PuroClean, a leader in property emergency services. It's the paramedics of property damage, providing water damage remediation, flood water removal, fire and smoke damage remediation, mold and biohazard cleanups. You can reach them at puroclean.com or 800-775-7876. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.